Good morning or good afternoon. Hi. It's good to see friendly faces and folks that I know, and it's good to see others who are coming today. I hope to learn some new things about hunger here in Arkansas and the possibilities that we have for solving and ending the issues of those not having enough or wondering where their next meal would come from. As you know, my name is Rhonda Sanders, and I am the CEO at Arkansas Food Bank. And we are here today because hunger is a crisis that affects everyone. We don't know when it's going to happen, but most of us know someone that is affected by the fact that they don't know where their next meal is going to come from. But the truth of the matter is this really is a community issue. It affects each and every community in our state. Because when you think about it, we won't have an educated workforce if our children aren't able to learn and sit in class and absorb what they need to absorb. We won't have a primed and ready workforce if they're not educated and if they're hungry. We won't be able to get better jobs and better things for our citizens. So it really is an issue of how our communities will exist in the future. Will crime be on the rise, or will our communities be ready to fight for what they need and able to do the jobs that they need to do? No one deserves to be hungry. I don't think there's any one of us on any given day that wakes up and feels like this is the day that I deserve to be hungry or that my neighbor deserves to be hungry. It's the most basic need that we have for food and water. But yet in Arkansas, 1 in 5, or about 550,000 Arkansans, don't know where their next meal is coming from. So that's why we're here today. We're going to talk to some experts, not me. You're going to be talking today to those who are actual boots on the ground. I'm thrilled today to have Ron Cook with Little Rock Church, Annette Dove with Tops Inc. from Pine Bluff, and Tina Hillman from Carlisle United Methodist Church. These are 3 partners and 3 warriors in our community. They work with Arkansas Food Bank, and they work diligently in their communities to see that we're alleviating hunger and we're doing the very best that we can do. So I want to ask each one of them to start off by telling us a little bit about your program and about how you're making a difference in the community. And then I have some questions that I'm going to ask each one of them, and then we'll be able to open it up to you, hopefully, to ask more questions and have a discussion. Annette, you want to go first?
Good morning. I'm Annette Dove, the Executive Director of TOPS, which is a nonprofit. We've been around for 15 years. In 2009, we started our summer feeding program. Right now, we feed 800 children during the summer months, breakfast and lunch. During the fall, we feed 400. We recently, I didn't call it a pantry at first. We just started having emergency food. What we noticed in Pine Bluff, we have a lot of senior citizens that were taking care of their grandchildren, and they were on fixed incomes. They did not have enough to provide for those children. So we just wanted to make sure the children we were serving, that the grandparents could come and get extra. Sometimes the children would even tell you, can I take something home? What we noticed in our food program, you didn't give me how much time, but anyway, what we noticed, some of the children would eat their supper and want to save some of it, which was not allowed by the state. And we realized they were carrying it, wanting to carry it home to feed their parents and other siblings that were at home. We just recently started feeding a distribution of emergency food boxes. Last month we did 408, and we ran out. And I'm talking about people really in need. A large number were seniors, a large number had illness and could not afford the food.
My name is Ron Cook. I serve on the ministry staff at Little Rock Church. We're in southwest Little Rock on Baseline Road. Our congregation has been a partner in the community serving food to our community for about 30 years, pretty much since the church has been in existence. Today we're open and serving as we do every other Monday throughout the year, a hot meal this afternoon and a box of groceries to all those who come up. We'll serve about 136 families today with a box of groceries, and we'll serve about 200 individuals who are present a hot meal. That hot meal, the groceries in the box largely come from the Arkansas Food Bank, and the food that is prepared by church members, most of the product comes from the Arkansas Food Bank. And so we've been thankful for our partnership with the Arkansas Food Bank and previously our partner with the Rice Depot. It's partnerships like that have made it possible for us to be a contributor in our community. We benefit by a number of folks in the community. Today, I think I counted 18 members from our community who are volunteers with us, helping to prepare for today's event, that hot meal and the boxes of groceries. And so one of the things that we're trying to accomplish, and not only serving hot meals and boxes of groceries, is partnerships with individuals to help them join with us in addressing the immediate needs of hunger. But we're also looking for partners, and have been for a number of years, to help try to stem the tide of hunger in our community by building capacity with folks in our community, whether it's helping them find employment or get training for employment, helping them solve problems that are contributing to their hunger. So we're glad to be a part of this partnership, and that's a little bit about what we're doing in Southwest Little Rock at Little Rock Church.
I hope everybody had a good lunch today. Did you? Has everybody eaten today in here? Raise your hand if you've eaten a meal today. Oh, some of you haven't. I am a rice farmer from Carlisle, Arkansas, which is about 28 miles towards Memphis from here. And my husband and I started noticing in our small town, which doesn't have a stoplight, a dry cleaners, we've got a Sonic, Nick's Barbecue, and a grocery store. That's it. The senior community does not have transportation like we do. How many of you drove here today? Okay. How many can go to the grocery store and drive yourself there? You can. 8 miles away, if they're a senior, they can either choose to pay their medical bills, their utility bills, or put gas in their car. And what's left is for food. They can't buy it anymore. With the SNAP program, I don't know if you all are familiar with SNAP, the Supplemental Nutritional Assistance Program. A person is considered a senior in Arkansas at the age of 60. Do you know how much money they get a month from SNAP? A widow, just guess. You know, $12. What can $12 buy, guys? Not a whole lot. But these seniors, I hate to use the word proud, they don't feel like they are the ones that need the food, the assistance. They feel like it should go to someone else. And so they won't sign up for it. So our mission at Carlisle United Methodist Church, we're new. We've been a member of the food bank for a year and a half. We started with 12 seniors. We now have 50 in my little town of Carlisle. Our church is fully funding this. Today was our distribution day. Normally there's 6 pages of food for me to choose from. 15 pages of food for me to choose from. Today there was only 6. We have a problem in our nation. Our food is not readily available as it was. As a farmer, I want it to be safe, nutritious, and affordable for you all and for everyone else. So I got involved because it's what we do. We feed the world. And thank goodness for the food bank. I ordered 3,000 pounds of food today, and it was $700 because of Kroger, Walmart, other places make it affordable. And it only costs $175 a year to be a member of the food bank. So when you see in the grocery stores that you can give $1 here or $1 there, please do it, because you know what? It's staying in your community. It might be your grandmother or your grandfather that I'm helping to feed. So thank you all.
Okay. Thank you all. As you can see, these folks know who's coming. They see the hungry every day. And those are the things that, we kind of have this perception of who it is that's hungry. But there are some realities of who that is. 33% of the people who come to our pantries are children. 35% are working families. So would y'all like to tell me a little bit more? I know you told us quite a bit about who you serve, but who do you see coming to your pantries? Tell us about them.
Just like I said, we have at TOPS, we run 12 different programs, but the children that we feed are from the housing areas. We have what we call a share table. That table is provided if somebody doesn't want something in their meal. When the children are in line racing to get to that share table, that tells you something. My eyes were open when one of the workers called and said, "Miss Dove, I can't even get out of the car with the food. The children are surrounding them." She said she had a child that was going in the trash behind someone else after they had eaten part of their sandwich. That means that child is hungry. We meet the regular USDA guidelines, and sometimes that's 2 ounces or 4 ounces. That's a half a cup. Some of these children, sometimes that meal is, if they're not at school eating, then that's the only thing that they're going to have. Also now, just like I said, with our distributions to our seniors, I'm seeing people come in there saying, I couldn't afford any food because I had to buy my cancer medicine this month. They're on walkers. They can't even carry the boxes out unless our volunteers help carry those boxes. They're sincere, and just like you said, a lot of them have so much pride when they cry when you give them something because they have not had food for a while, or they save part of their meal to carry over for the next meal. That's what you see. It's real. It is real what we see.
We serve families, we serve seniors through our bi-weekly event. I was sitting here thinking about the couple who bring their 4 children. We sit at the same place where we spread out white paper and put crayons out so that kids can sit there and color with their parents if they choose to do so, or grandparents. And that father will take his kids and shoot some basketball while the hot meal is, we're wrapping up preparations for that. They're there every week. Usually the father's clothes are fairly soiled because he's just come from his workplace. About a third on any given day of our attendees, our guests, will claim a document as they register that somebody in their family is currently employed. We're serving folks who are out there trying to make a living, but can't quite make ends meet. And so that encourages us to come alongside and try to get to know, because these folks are bringing their very best. We also have another family that I'm thinking about who come pretty regularly, and at least 2 of the child and what appears to be a teenager both have developmental disabilities. One's in a wheelchair and needs a lot of care. Now, I have a son with developmental disabilities who's high functioning, and I know when he was younger how difficult it was to get him out in public and take him to a restaurant or somewhere. I can't imagine how much work it is for that family to bring their kids to our hot meal and box of groceries, except that it's an important social event to get out and socialize and see friends in a safe and comfortable and peaceful place, and it's also important to get that hot meal and box of groceries. And so we see families with developmental kids with developmental disabilities who need that extra support to make ends meet, especially at the end of the month. And they're teaching us a lot about what it means to be a good neighbor, because inevitably, every event we'll have one family who'll hear about a family who's come in late, and we've given out all our extras that we have for that day, and our hot meal is, and inevitably we'll have a gentleman or a family come up and say, we want to give our box to that family. We see they came in late, and we want them to have it. That's that generosity that inspires us to continue to do what we try to do.
Let me take you through a typical day at our pantry. We have a little man named Mr. Jerry, who's 86 years old, that gets up and comes and brews coffee in one of those great big church coffee pots. And then we'll have one of the other ladies from the church make maybe some cinnamon rolls or some sausage balls or something. And then our pantry doors open at 9 a.m. They are out there at 8 o'clock waiting to come in. And you know how hot it's been lately. One of the ladies passed out, fell, broke her arm. She had given herself a insulin shot before she got there, but she was so afraid she was going to miss her food. But it's also, that's helped us minister to her and be able to deliver to her now that she's been injured. And when I got to her house, she had nothing in her refrigerator. She had no hot water because she couldn't afford to pay the bill. We don't know what's going on in our own backyards because the seniors will not tell us. Arkansas is second in the nation in senior hunger. Shame on us. So they'll come in after and get their coffee and they talk. We've lost 5 ladies from cancer in this last year. And their families have come back to thank us because they live far away. And they knew that they didn't have anyone to help them. So we also make deliveries to their homes, and sometimes they need help with simple things like going out to the mailbox and bringing their mail in. Although in Carlisle, not very many people have mailboxes, we still have post office boxes. So that's another way of meeting up at the post office. And we get our word out through flyers. At our little grocery store and the post office and the tobacco store. Unfortunately, they would rather sometimes have that vice, that one comfort. And I don't know how to get around that, but they do appreciate the food. We gave them a luncheon, and we put the tablecloths out and had candles and did smothered chicken and rice, and they were so appreciative because they don't get to do things like that. So the simple things that we take for granted mean a lot to them, especially food.
Thank you. We talk a lot about good nutrition, and I think across the United States it's been a pretty big trend to talk about eating more nutritious, being more healthy. And guess what? In the South, it's starting to catch on too. We're constantly talking about it. We're constantly looking for those ways to improve what we're eating. That can be a challenge when you're talking about a family that doesn't have the ways or means maybe to access that. We've talked a lot about it at the food bank and believing that those who are hungry and those who we're serving deserve to have the same types of food that we have in their grocery stores. So talk to me a little bit about how important nutrition is, how you're handling that within your pantry. What do you see the future being for where we need to go with improving the nutritious content?
This summer, during our summer program, I actually had 6 young kids insulin dependent. What that means, if they're not getting a nutritious meal other than sugar, they have a problem. A lot of times, we see families that mothers are working 2 part-time jobs, so the kids are trying to feed themselves. They don't know how to cook, so the first thing they're going to go for is snacks. So one thing that we try to do is show our young people. We have a small garden, and we try to teach them to cook and show them how to cook little meals and story zucchini squash. When I was growing up, my dad said he didn't like squash, so I didn't like squash. And my mother worked for Jefferson County Extension Service, so she made squash in a casserole one day, and we were really eating it. And mother said, "You want some more squash?" My dad said, "We don't eat squash." I said, "We don't eat squash." She said, "That's what you've been eating." So we try to show the children how to eat nutritious food that they might not be exposed to. A lot of times they'll like it. It's just trying to teach them different ways of preparing for it. If you are hungry, you cannot focus. You can't focus in school. Your behavior is off the chain. When they've had too much sugar, we can tell it, because they cannot sit still, they can't think straight. And so we try to encourage them. We do a lot of nutritious lessons. Matter of fact, we're part of Healthy Arkansas. We have that program in our center. We try to encourage more water instead of a lot of the sugary drinks that they're used to drinking. So it's important. Nutrition is very, very important, and education of nutrition is very important.
Well, I think of a couple of things that we've made a shift in the last 7 years. Is we've made a determined effort to not spend our dollars intentionally on food product that doesn't have some measurable nutritional value. And so we don't buy colas. We don't buy them from, if the food bank happens to receive it and distribute it, we don't take it. We're going to spend our money and our capacity on trying to get the best product, nutritionally speaking, that we can get. And that's just a value, a commitment we've made in our pantry, and hopefully we're delivering that in both the hot meal and the box of groceries to the extent we have those options available to us. I think another thing that we're committed to is being a bridge to our community, a bridge of information. Now, we know one of the biggest obstacles to moving people out of an impoverished, economically impoverished state is getting them more information. It's that lack of access to information. It's that lack of access to opportunity that we want to try to overcome for those who come to us. Now, folks, we recognize they don't come to get a lecture from us, all right? If anybody needs lecturing, it's probably me, and I'll get that at home. So I won't in turn give out the lecture either. But we do try to find creative ways to spread the information around. And so we'll have outside groups, we'll have organizations come set up a table and provide a cooking demonstration while our guests are waiting to eat their hot meal. Or there'll be other, whether it's health related or nutritional related, we'll try to have nonprofit organizations come and make that information available. We want to bridge the gap that exists to folks in our community. They may know what they need to do, but don't feel like they have access to it or know how to get that. And so we want to try to tear down some of those obstacles and build bridges. So we think providing information, the quality of product that we can, and also encouraging the type of information and bridge building is an important part of what we can do in our community.
The food bank each month has fresh produce that is given from Kroger or somewhere. And so what we did this month is I ordered bread, tomato, and some cheese. And so I will show them how it'll be out on a table when they get there to make a healthy open-faced sandwich. Another thing I ordered this month was rice and raisins, and you can mix that with a little coconut milk, and that would be something different for them. So each month I try to show them a different easy recipe, and I have a purpose for my ordering, which is if you show them, it's so much easier to understand. And if it's flavorful and you can add some spices to it, they're more apt to go home and do that. Tyson also has started donating restaurant quality food, which is amazing. Today we had the Tyson chicken fried steak, and so we supplemented that with gravy packets that we went and bought. and they can use rice, gravy, and have chicken. So I try to show them recipes each month, and they love it.
I always like hearing. I don't always get to hear these stories, y'all. So just letting you know, I'm as engrossed as everyone else. I love hearing what our agencies do, and I know that every day they're out there meeting people. And back when the recession happened, we've almost forgotten about it, right? We really saw a huge increase in those who were coming and that were in need. And over the last few years, it has stabilized somewhat. We've seen things kind of get a little bit more back to normal. But tell me, are y'all seeing increases or shifts in those who are coming to you?
When I was contacted by the food bank, wanting to know if we could do a overall distribution, I said, sure, because we have our emergency room. But I couldn't believe my eyes to see. The first one we completed, I think we had about 300. This last month, it was 408 families. And people were still coming, and we were out of food. You can kind of tell when a need is there. And just like I said, a large number, and this is during the day, were needing help to get inside the building because we don't distribute, we don't deliver. We need to, because a lot of them don't have transportation. But yes, we're seeing, we could have fed probably almost double. When I went back to review how we got our word out, because we're new at doing this, it was only a flyer in the newspaper and on Facebook. How many seniors are on Facebook? How many people read the paper? So the others were word of mouth. And I just, on the 7th of this month, when we do it again, I don't know what to expect. But we have a great need in Jefferson County.
When people ask me how many could we serve at our pantry, I really have no way to know how to answer that. I mean, when I say we serve 132 or 136 families each of our event, that's just based on our capacity to deliver, both in human resource capacity to serve and finances to purchase. But that doesn't mean that that's how many families need food in the 72209 zip code, or whoever comes to our location. And so I think it's a little misleading if you take a look at the partners of the Arkansas Food Bank and just take their numbers and say, well, that equals the need, because probably not. It's certainly not in our location. We have to set up. We set up in a certain way that sometimes people will come to our event, and as I've alluded to earlier, we have set up our boxes, and we don't have any more to give because we've been giving them out. Now, we'll always have some canned goods. We have some emergency boxes we can put together, but the bulk of our groceries we've given out. And when in 2011 and 2012, our numbers spiked by over 25%. That trickled down, I guess, from the recession, and so we kept increasing our numbers, and we were clearly hitting our capacity at 2012. Now, as it's been seen, our numbers have stabilized, and we're serving about 8,000 to 9,000 individuals a year through our event. But look, the need is great. I think the challenge is we don't know how great the need is, and equally important to us is we're challenged to find answers to curb that need, find solutions not only to the immediate need of hunger, but how can we get back to the causes and be a participant in helping stop children from being hungry and stop having parents send their kids to school knowing and feeling bad that they're sending their kids. Look, when we find kids in school who are hungry, we don't assume that the parents don't care. In fact, it's my experience in working in neighborhoods like this for 30 years and living in them, the great majority of the adults care about their kids. But the fact that their kids are hungry doesn't mean they don't care. It may mean that they haven't had the opportunities that they need to solve their own problems for themselves and their children. We want to be a part of not only helping meet their needs for today, but helping them solve some of those problems.
A year and a half ago, we had 14 people at our food pantry. Today, we serve over 50. And they're all there right at 9 o'clock. So it was hard to get the food out to their cars because we carry it out for them. And so I reached out to our high school National Honor Society kids, and our superintendent has allowed those kids to come on their second period class to help. And the seniors love it. Well, I didn't realize that these kids' grandparents and parents also needed food. So we probably got, when they started, I guess last school year, they started helping in December. And I think we got 15 more clients because of these kids helping. We're a town of 2,200 people. And like you said, there's no computers, no Facebook that these people have, so it's all been through word of mouth. And we're just going to continue to grow because the need is so great.
I'm going to ask them one more question, and then I think, is it okay to have the group here ask you a few questions? This last question, really to let us know, what are your biggest needs that you have at your pantry to keep it stable and to allow your programs to become more effective and long-lasting? What do you see as your greatest need?
The other day, from when we gave out our last distribution, I realized we always kept canned goods and things available if someone walks in our door or if an agency calls and want to refer someone to us. We've always had food. The other day, we had none. I went up and I looked in the freezer and we had a few packages of meat, but we had no canned goods. So I realized that we're stretching to the next level from our budget. We try to, and we don't really have a budget. We just know that we have to provide assistance. When we do get our truck in, we try to provide at least those items like bread and vegetables and those things, sometimes meat, because we don't have it. Our needs for our children is getting them there to the center. The state will not allow us to take it out to them, to their homes. So if the kids can come, transportation is a big issue. You heard me say that we have phone calls. Can you all deliver us a box? Can you deliver? I have no transportation. We're not allowed to do that because we don't have that transportation. So transportation is a big key. I guess extended funding to be able to purchase more food from the food bank. And just like I said, buying food at cost is, and a lot of things we get free to help us. We try to make sure when we do our boxes, they have at least for 3 or 4 days. We try to put that much in a box because we know if grandparents have 5 and 6 children at home, they need the food. So that's what I would say.
Yeah, I think first of the capacity building grants that we've and so many of the partners of the Arkansas Food Bank have benefited by through both perhaps public funds as well as private giving, where those grants are awarded to partners of the Arkansas Food Bank to help us purchase capacity building items, whether it's a pot rack or some delivery system or storage facility. That has been an incredible benefit. And so I am thankful for the funds, both public and private, that come to the Arkansas Food Bank and the various ways that they sometimes, through grants, get to organizations like ours, because it has meant a major difference in our ability to deliver. I think a second need that we have is to continue to be connected to institutions like this one and the Arkansas Food Bank and others to help us fight the misunderstanding and the myths about poverty. And to be quite honest, it's part of my role within our own small congregation that when we talk about in our assemblies of our church about the Arkansas Food Bank and its ministry, or our local pantry in our congregation, one of the things I'm focused on is taking aim at those myths myths about poverty, myths about hunger, who is hungry, why are they hungry. There's a lot of misunderstanding, and we really see it as one of our roles as being on the edge of trying to communicate what's real about hunger and poverty and what's a myth. And then the third thing is staying connected to partners, the Arkansas Food Bank, Arkansas Hunger Relief Alliance, and so many others in our local community who can, as I alluded to earlier, knock down those barriers between those who are hungry and the partners and the organizations and the information that our neighbors need to help improve their lives. They're working hard to do so, but oftentimes they lack the access. And having partners like many of you to help us accomplish that is really an important part of what we do.
How many of you have actually been to the Arkansas Food Bank? I encourage you to go. I do not know how they have taken from the ground up and done the phenomenal things that they have done, from the warehouse to the delivery drivers to you. It's a class act. You should be so proud that we have it here and all the people that work so hard. Because little rural towns like Carlisle, we couldn't have this blessing if it weren't for the food bank. And the Arkansas Rice Depot has now merged with them, and we give tons of rice to the Rice Depot. And I hope everybody in here is eating Arkansas rice, by the way. I have a funny story. Sometimes when you're ordering from the food bank, you don't know exactly what you're getting because it's a big box from Tyson. Well, I ordered whole chickens, thinking there was 4 chickens to a box. There was 14 chickens to a box. I ordered 13 boxes. We only have 50. And I thought, oh, dear goodness, what am I going to do? So I contacted this little man that lives in our town, and he smoked those chickens for me. So this month, they're all getting smoked chickens. And these chickens were like, I got all those chickens for $57, over 150 chickens. So I think our greatest need is probably, we don't have a computer to work with at all. And when the people come to the food pantry, they have to check in because they have to have the data and the paperwork to show who they're serving. So we have to do it manually, one by one. And I have a group of 12 women. Since we are faith-based, if there is a need for running out of food, all I have to do is make a phone call. They'll go to the grocery store and bring it. Like today, one of the things that we got was the Halloween icing with the little sprinkles on top. Well, I didn't have a cake mix to serve with it, so they went and got cake mix. And those people don't usually get things like that. That's a luxury to have a seasonal cake. So if we could get a computer system in, that would be great. But to us, that's a luxury too. We don't mind being the boots on the ground, like you said.
I want to give y'all a chance to maybe ask a question of our panelists. I've just appreciated what all they've said. They've done a great job of explaining things, but some of you may have some burning questions that you want to ask them.
Well, now, Tina, you may hate tobacco, and I may hate tobacco, But you know it kills the hunger pains, and it keeps you awake for that second job if you're working minimum wage and you got to work 2 jobs. And don't worry, the fact that the healthcare costs are more for tobacco smokers, they die sooner. There's a net zero loss to
I'm going to make you feel
society.
really bad. My mother died of lung cancer, so I hate tobacco.
Annette, when I was at TOP several years ago when we were having our conversation, you were talking about state restrictions that constrained your ability to build your program and feed more of your neighbors. What's the #1 policy that you think the state should adopt to let you loose to amplify your work? And if you all haven't been to TOPS, I don't live here, I live in Arlington, Virginia. There is not a place in the country that is as good as TOPS.
Wow. Thank you. We are governed by USDA, and I'm a school teacher and a federal person, so I follow guidelines, #1, okay? They tell us that when we feed our children, we give them the 5-component meal. A lot of time our children probably can't eat all of it. Now you have those who can eat that and probably 2 or 3 more meals, but they cannot take anything out of that door. They call it now, they restrict us, they've opened the door for us to say they can take a traveling apple. I don't let them travel with anything because you never know who's monitoring you, and that one apple could be something else. Many of these children that we see, and you've heard me say about the share table, they race, and I'm seriously telling you, they're in line to see who can get whatever is left over. When they go in the trash behind someone else, that means they're hungry. And if they could allow us to even carry some of the leftover, like the milk, we have to throw all of that away. We have families who could use that milk, but state guidelines says you have to throw that milk in the trash if they don't drink it. To me, that is just hard. It is hard. We have to do it because I don't want to be the one on the front page of the paper. But if we could look at those rules, because someone could use that milk. But that would be being able to allow them, because a lot of times they're taking food so they can eat later on that night. I don't know, when I eat lunch, I'm ready for supper by the time I get home. And a lot of these kids, and they run in the door, what are we eating today? What are we eating today? So that's the reason a lot of times we cook extra at the center to teach them, that's our cooking lesson, that they can be able to go home and, just like you said, some of them don't even have gas. They don't have utilities. Someone told me the other day, and I don't mean to, we need to do more on health issues. Yes, we address that, but how do you do that when they don't have it? When they don't have running water at home? And it's not a child's fault who their parents are.
Another
Thank
question?
you for the compliment.
I'll say that I work for the food bank, so I don't work in direct correlation with the agencies, which I hate because I have other things, but I appreciate everything that y'all do to help in your communities, and I hate that I can't see it one-on-one on a daily, weekly basis. But we talked a lot about the barriers of trying to serve people, transportation being one of them, just sheer education. But we talked about nutrition as well. And with more nutrition comes a higher cost, obviously. So when you're placing your order, you're already short, essentially, trying to serve people. How do you prioritize ordering over nutrition? Do you think that serving more people is going to affect their lives better than maybe serving a few less people with more nutritious content?
Well, in our particular case, I would say that the aim for nutritional food is a value, but we can't apply it as a rule because none of us actually get to decide what's on our ordering list as a partner of the Arkansas Food Bank. And what we have seen, though, is a very deliberate focus by the Arkansas Food Bank to go after, in creative ways, adding to their inventory a nutritional product, and we're going to go after it. Now, we have other pantries we're competing with, and so I'm going to call ahead of Annette as much as I possibly can. No, I'm kidding. So it's a value that we're all talking about, and as a member of the advisory group at the Arkansas Food Bank over the last few years, we've been talking about this for 5 or 6 years, and the Arkansas Food Bank leads us in that effort, and Feed America and its partners to help us get the biggest bang for our buck. But because it's not an ideal world, your question is posed a little bit more strictly than we unfortunately get to live by. And so we do the best we can with I'm sure like our partners here, with the money that we have available, the inventory that's available to us. We have a lot more we could do. We've piloted a community garden to promote that and to illustrate that, but that's just a drop in the bucket. That's symbolic and illustrative, not necessarily a solution, but we're doing everything we can to try to keep that conversation going in our community.
I want to say this. On our last distribution, we had completed 408 families, and we were having people still come. You want to hurt my heart is to tell someone we're out. I was running around, running upstairs, trying to put together just enough boxes from our feeding food that we feed our children, because I could not stand to see these people walk out of there. And when I say more seniors that own walkers, and when I told a young lady, and she appeared to be in her 70s, that we were out, tears just walked, and I had to stop. I said, hold on, let me just go find something. Because for them to take the effort to try to get there, and just like she said, we opened at 11. At 9 o'clock, we had a line of people. And I'm not talking about young people. We had to put out chairs so they could have a seat outside the building for their turn, because we have to do the paperwork. But it's heartbreaking to see this. And I try to really express to our children about eating a variety of food, because people are hungry. And we can't afford to throw food away. So we try to encourage our children to try it. I'm going to say, just try it. Just one bite. Let me see you do one bite. And so a lot of times that's, oh, well, give me a second bite, you know. But a lot of times they're not exposed to healthy food at home.
Because it's got to be disheartening as much as you want to do everything you can.
It's not disheartening. It kind of builds a fire in you to make it better. And my situation is a little different than theirs, because I can make a phone call and somebody can run out and buy some food and bring it back. And we've not yet turned away people without food. But the way I order is I try to find all the low sodium things first. And that may be something that the food bank can do, is ask the vendors to do more of that. And that may be a little start.
Have time for one more. There you go.
Rhonda, can you talk about where you get your food and how the vendors work with you and what sources you're looking to help supply your partners?
Yes, I'd be glad to. Appreciate all the kind words that they've said about us. This was not meant to be a stoke the food bank party. The food bank is a resource to our local agencies. We have about 350 agencies and 101 schools that we seek to provide low-cost and free food to. Obviously, the model of food banking is that we have to acquire that food from somewhere, and we get it in a variety of ways. Only about 10% of our food is what you would consider government-sourced food, somewhere between 10 and 12%. That will be from your commodities, your TFAP, for USDA, children's feeding programs, things of that nature. All the rest of it is coming from somewhere else that we're getting it. We also purchase somewhere around 11% of our product is just out and out purchased at what we hope is the best price we can get. And we have someone who sources that and looks for it, and we get very good prices, and we pass on those things to our agencies. The rest of the food, around 75 to 80%, is what we refer to as donated product. We're able to acquire that locally from places like Skippy, ConAgra, our rice growers, local farmers, things of that nature. But we also are able to acquire food through Feeding America. They have a system that allows us to access national donations. Let's say if a Kellogg has a tremendous amount of cornflakes that they want to donate to us, we can access that through Feeding America. They have also done an excellent job at a grocery portal that allows us some really good pricing on things over the last year and a half that has helped. And the last area that we are looking to expand in has to do with our more nutritious food, and that is through produce. While we do not typically pay full price produce from a farmer, there are farmers outside of Arkansas that as they're in their growing season, they will have the ones that aren't marketable. They're not the pretty ones to go on the Walmart shelf. And those will be made available to food banks across the nation to access those. But we do have to pay a pretty high price for transportation. And then we have what's called VAP charges, which means putting it in a box or a tote, things like that make it more manageable and usable. Because when it comes out of the ground or out off the farm, it's typically put in just huge bins. And they need to have some cleaning and some sorting and some things like that. So we do have the opportunity to acquire food that way. So we get it from a lot of different sources. The one that you've heard mentioned a couple of times and that is really pretty significant also is our retail. We get a significant amount of food from our retail store pickup. That would be your Walmarts, Kroger's, Harps, all of those who have the product that's fixing to go out of date. Instead of throwing it away, we get to give access to our pantries or to bring it in and then transfer it down into some of the other areas of our state, which are extremely rural and have absolutely no access to food providers. So we try to do things in an equitable fashion, but we are constantly looking for new food sources. One of the discussions we had in the back room, where is it going? Where is the future of all of this going? Every futurist you talk to, economist, retailer, tells us the grocery stores and the food chains are changing drastically and rapidly. The grocery stores, the inside aisles, they're drying up. Things are going to where you're ordering online. Amazon is delivering in all of these huge cities now. There's not going to be as much left for others to access, like we're doing now. The model's changing. So at the food bank, we're really concerned about it. We're looking, how do we change our model to be in line with where the nation is going so that we can continue to get food to these folks. And I don't care if it ever comes in my doors, as long as I can be a conduit and a connector so that we're able to still get food to these folks so that they can feed people. I'm all about it. We're looking at how the food bank works differently in these changing times, and things are changing. So, how am I doing, Skip? Is that it? That's it. Thank y'all. Thank you. These guys are awesome, truly.
Thank you, Rhonda. What a great job she does, what a great job the food bank does. And thank you all for being out there on the front lines, because you were with the people, for the people, and doing great work for them. Thank you all very much for being here.